Welcome to Brunswick Health Watch, presented by Novant Health. I'm your host, June Baker. Today, we have a special show planned to learn more about the services offered at Brunswick Community Hospital. We welcome Brunswick Community Hospital's Chief Operating Officer, Matt Mendez, and the hospital's Imaging Services Manager, Peggy Singer. Then, Debbie Donahue and Barbara Walker will talk to us about the cardiopulmonary services offered at the hospital. Stay with us for the next half hour as we bring you Brunswick Health Watch. Let's first welcome Brunswick Community Hospital's Chief Operating Officer, Matt Mendez. Welcome to the show, Matt. Thanks so much for being here today.
Thank you, June. It's absolutely my pleasure.
Great. I'd like to start off today by learning more about you. Can you tell me how long have you been Chief Operating Officer at Brunswick Hospital?
Sure. I joined Novant and Brunswick Community Hospital in April of 2007, so it's been a little over 2.5 years now.
Wow. Time flies, huh?
It does indeed.
What did you do before coming to Brunswick County?
Well, I've been in the area about 12 years, and prior to joining Novant, I served as the administrator of Pender Memorial Hospital, part of New Hanover Regional Medical Center in Wilmington. And then prior to that, I was an assistant VP of operations with them as well.
Wow, it sounds like you bring a great deal of experience to Brunswick Community Hospital. Can you tell us a little bit more about the facility here at In Supply?
Absolutely, and I'd be happy to even talk about Novant as well as a system. And just to kind of frame it for the audience, Novant is a not-for-profit integrated delivery system that has 26,000 employees, roughly 12 hospitals, 1,000 physicians, 3 long-term care facilities, serving patients from Virginia to South Carolina, and roughly 5 million patients are the amount of folks that we actually serve and that we touch on a daily basis.
Wow, that's a lot.
Yeah.
That's a lot of folks. Well, let's talk a little bit about the hospital, in particular, Brunswick Community Hospital. When was that built?
Sure. We've been serving this community for about 32 years now, and we're also not-for-profit general community hospital, 60 beds. We provide medical surgical services as well as intensive care and progressive care unit. We have a maternity center. We have a 24-hour emergency department. We have ancillary diagnostic services such as lab, pharmacy, rehabilitation services, imaging as well. We also offer rehab, physical therapy, speech therapy, cardio and pulmonary therapy as well. And we also provide diagnostic imaging and lab services at a freestanding center called the C-Trail Center. So we offer a wide array of services to our community.
So it's a full-service facility then?
Yes, we are.
Great. That's really good information, Matt. I understand that there are many new services that have recently been added to Brunswick Community Hospital. Let's talk a little bit about those.
Sure. Well, part of our goal is to ensure that our community has access to care. And so we want to make sure that they have local options and local choice. And we've had a lot of growth in our physician group. We've been able to bring a lot of primary care providers to the community that has helped folks to be able to seek care locally. In addition, at the hospital, we've been able to bring on several new services in the last few years. Specifically, we've been able to add stereotactic breast biopsy services, recently cardiac catheterization service, lithotripsy service. We've also added speech therapy that I mentioned earlier. We've added pulmonary therapy as a new service line, even a golf fitness program, which has been popular.
I bet that's a big hit here in Brunswick County.
It has been. So we really try to be responsive to our community and identify what the needs are and ensure that those are things that are appropriate for us to provide. How
about your hours in the lab and in imaging? Are those fairly long hours? I mean,
absolutely. We're very flexible. We have very extensive scheduling hours for our imaging as well as for lab services, so it's really never an issue for our community to be able to access those services.
And I read in the paper recently that we've a new hospitalist program at Brunswick?
We do. We absolutely do. The hospitalist program is a program that is relatively new for us. We've actually completed the growth of our group. We have 6 hospitalists that actually serve our inpatients. And so as a patient is admitted to the hospitalist provides their care for the duration that they're with us in the hospital setting. And they're just an outstanding group. We've had a lot of really good feedback from our community and with this program. In addition, we have a new anesthesia group as well, and they're doing really great things for our community as well.
Well, one more thing about the hospitalist program. Now, when the patient's discharged, the patient's then sent back to their primary care
That's correct.
physician?
That is correct, and we get that question a lot. The hospitalist is their primary provider in the hospital setting, and then when the patient is discharged, they're discharged back to their primary care provider. So any information that needs to be relayed goes right back to their provider. So there's there's good continuity of care.
Yeah, that's real good information for our viewers. Well, it sounds like a lot of expansion is going on. So what else is going on at the hospital?
Well, there has been a lot of growth, and our community growth has grown significantly, and we've, as I've said before, we try to be proactive in anticipating their needs, but we're also very focused on quality outcomes and safety, as well as satisfaction in providing our patients with a remarkable experience in every dimension, every time. So we're very proud about some of the things that have occurred in the quality arena, and I'd love to share with you a couple of things in that area.
That'd be great.
Back in 2006, when Novant joined this community, we had some challenges in some of the areas that we measure our quality performance, specifically heart failure, acute myocardial infarction, pneumonia, surgical infection prevention, and we were in the low 60 percentile for all of those. Within about a year and a half, 2-year period of time, we were able to elevate those to upwards of low 90 percentile. In fact, we were one of 9 hospitals in the state, rather, that had most improvement in 2 of those areas, in pneumonia and surgical infection prevention.
Wow, that's quite a feat.
It is, and it's been through working in conjunction with our physician partners and our staff, and really making sure that we're doing the right things at the right times. And I'm also excited to tell you that in 2009, we were recently recognized again by the North Carolina Quality Center for being the most highly reliable hospital in the state for surgical infection prevention. We were the only one to receive that recognition statewide.
Wow, congratulations on that. That is amazing. Well, I heard you mention customer service. Are there special efforts in that area?
Absolutely. We believe that our patients, they really need to have something beyond just good quality care. We want to deliver them something that is unique, that is special, that is custom tailored to that individual. And we want to deliver them a remarkable patient experience. And there's a lot of efforts focused on creating that special relationship and that special experience. And we pride ourselves in how we do that and how we connect with our patients on an individual basis. When they're with us, they're with family.
So, Matt, in addition to all of that, a new hospital is on the horizon. Is that correct?
Absolutely it is, and I think that our staff and our team is as excited as the community is about this new chapter for the history of Brunswick Community Hospital.
So let's talk a little bit about time frame. When do we expect this new hospital to be completed?
Well, the project is on pace, it's on target, and we anticipate occupying summer 2011.
Right around the corner.
It is. It'll be here quick.
Well, how about space-wise? Is it larger than the old facility?
It is a significant enhancement in terms of footprint and number of floors. Today's existing facility is roughly 75,000 square feet. The future facility will be roughly 250,000 square feet. We're a single floor today, single story, and will be a 4-story facility in the future.
Elevators?
Absolutely.
That will be a change.
A big change.
How about operating rooms? More?
We will have, presently we have 4 operating rooms, and so in the future facility we'll have 5 operating rooms.
Okay. And the ER, I think you currently have, what, 12 beds?
We have a 12-bed facility today, and we'll be going to a 20-bed ED in the future.
That's a significant increase.
It is quite a big increase.
And is that due to the population, the increase in the population here in Brunswick County? Or?
Absolutely, absolutely. We have a great number of patients that seek care in our emergency department. We serve about 24,000 patients a year in the ED, and about 60% of the patients that end up being admitted originate from the emergency department. So it really is a driver for our services.
And the location, let's talk about the location a little bit.
Sure, sure. Well, it's Highway 17. It's about 3 miles north of our existing location on the left-hand side if you're going north, and on the right-hand side going south. And we're not too far, so the move should be fairly fluid and smooth for us.
Oh, that'll be an exciting day.
It will be.
Will there be provisions for offices for physicians in proximity to the hospital?
Absolutely. We envision developing a medical office building which will be connected to the hospital and allow our primary and our specialty providers to be able to have good close access to the hospital campus.
And so again, you think in summer of 2011?
That's correct.
Wow, just right around the corner, so we'll all be looking forward to that.
It is. Well, we're thrilled and excited to be able to bring something that this community has not had in many years, but I think more importantly, I feel like we're going to have a facility that really matches the caliber and the talent and the passion that our staff brings today to every patient that we serve.
Wow. Well, Matt, that's great information. Thank you so much for being here today. We so appreciate it.
It's my pleasure. Thank you for having me.
You're welcome.